Hey everyone, my name is Chesterson, and for week 8, I decided to plan and design a health behavior campaign, and my campaign is titled Philly Prevents Diabetes. Hey everyone, my name is Chesterson, and for week 8, I decided to plan and design a health behavior campaign, and my campaign is titled Philly Prevents Diabetes. Prediabetes is a condition in which blood sugar levels are higher than normal, but not high enough to be considered diabetes. Current estimates indicate that about 96 million American adults are living with prediabetes, but unfortunately, the majority, about 80% of these individuals, are unaware that they carry this diagnosis. Prediabetes is considered to be a high-risk state for the development of type 2 diabetes, and about 5 to 10% of those with prediabetes do progress into type 2 diabetes every year. According to the American Diabetes Association, about 70% of people with prediabetes will go on to develop type 2 diabetes at some point in their lifetime. So the question becomes, why are we so focused on preventing diabetes? Unfortunately, 1/4 of healthcare dollars in the United States are spent on care for people with diabetes. This is a vast majority of money and can be saved if we invest more time and energy into preventing a diagnosis of diabetes. People who carry a diagnosis of diabetes are more likely to be absent from work, have lower productivity, and have an increased chance of not being able to work or being considered disabled. Uncontrolled diabetes is associated with a host of conditions, including heart and blood vessel disease, nerve problems, kidney damage, eye disease, foot problems, and many more. Due to the large problem of diabetes, prediabetes and diabetes prevention has become a focus of a lot of research. Research indicates that weight loss and increasing physical activity can help to prevent or delay a diagnosis of type 2 diabetes. Data published by the CDC showed that individuals who participated in a lifestyle change program with an emphasis on healthy eating and physical activity were able to reduce their risk of type 2 diabetes by about 58% compared to those who did not participate. Because of this research, the CDC developed a national diabetes prevention program in 2010. This year-long lifestyle change program aims to decrease the prevalence of prediabetes in the United States by helping people to prevent or delay that diagnosis through healthy lifestyle changes. Trained lifestyle coaches, who are meant to be community members, lead participants through the CDC-approved curriculum and help those involved try to make healthy lifestyle changes. Across the United States, there are currently about 2,000 organizations that provide this program. Diabetes and prediabetes disproportionately affect low-income populations, and research suggests that this inequality seems to have widened within the past 10 years. Chen et al. Suggest addressing risk factors early with the goal of diabetes prevention. Unfortunately, low-income minority women are additionally impacted by diabetes and prediabetes. They have a 2 times higher risk for developing diabetes than their white peers. Obesity is a common risk factor for the development of diabetes, and this condition more commonly affects Black and Hispanic women. Additionally, women's role as a caregiver in the home traditionally prevents participation in health prevention activities often. Targeting these populations, accounting for their barriers, can help to reduce the impact of diabetes and prediabetes on these communities. In the state of Pennsylvania, about 8% of the population lives in poverty. Get Healthy Philly reports that Philadelphia ranks the poorest among the 10 largest cities in the United States. In many areas of the city, unhealthy choices are made easiest, which leads to poor health outcomes. About 13 to 15% of Philadelphians carry a diagnosis of diabetes, and it's estimated that about 34% of Pennsylvanians live with a diagnosis of prediabetes. This could represent about 500,000 Philadelphians. With the lowest income population among the U.S.'s largest cities and a significant burden of diabetes and prediabetes, intervention is required in the Philadelphia region in order to improve the health of this low-income population. Currently in Philadelphia, there are 12 sites that offer the National Diabetes Prevention Program. Unfortunately, these programs are primarily located in central Philadelphia, which, according to the U.S. Census Bureau, is the wealthiest section of the city. Areas more consistently affected by poverty include South Philadelphia, Northeast Philadelphia, and West Philadelphia. In these areas, however, there are many fewer programs offering the National Diabetes Prevention Program. Creating a health behavior campaign and establishing the NDPP in these sections of the city would likely impact those women who are at greatest risk for both prediabetes and poverty. The theoretical basis of this health campaign would be the health belief model. This model focuses on factors that influence a person's health habits and choices. The primary concepts of the health belief model include perceived susceptibility, perceived severity, perceived benefits, and perceived barriers. The proposed prediabetes education and diabetes prevention program will address each of these constructs through its communication with the target audience. Working with primary care providers will help to target women with elevated blood sugar levels and will introduce this target audience to their susceptibility for developing diabetes. It's important for women with prediabetes to be aware of their condition, understand what it means, and understand the high risk of this condition progressing into type 2 diabetes. The health campaign will share statistics about progression from prediabetes to diabetes, and it will share stories from women who have progressed from prediabetes to diabetes. These women will come from communities being targeted by the campaign. Their stories may include women discussing the complications of diabetes that they have experienced, which can increase the understanding of the severity of the two conditions. The campaign will address perceived benefits by sharing the benefits of a healthy lifestyle. It will discuss benefits including being able to play with children more easily, seeing families grow up and create families of their own, and understanding the decreased spending on medications and overall healthcare costs that preventing diabetes can bring. Focusing on family and finances will address topics likely at the front of mind for women living in poverty. Demonstrating how healthy lifestyle choices will help to realize these goals will help the women be motivated to participate in the National Diabetes Prevention Program. There are likely many perceived barriers for this population, especially when considering participation in a year-long lifestyle change program. Distance required to travel to meetings, child care during sessions, availability of exercise, and cost of healthy food will be addressed through the program and the campaign. The campaign will plan to train community members as lifestyle coaches so that the program can be offered in neighborhoods across the city. These programs would be offered in churches, schools, and healthcare facilities in the low-income neighborhoods most affected by both poverty and prediabetes. This would significantly reduce the distance each participant would require to travel from their meeting center and their home. Childcare would be provided by a community member who would be incentivized to receive the same benefits as program participants. Exercise sessions would be offered after a program meeting, and the space would be reserved 2 other times each week for the women to use for exercise. The program would apply for grant funding to make arrangements with local farmers markets, grocery stores, and corner stores to offer coupons for healthy foods like fresh fruits and vegetables, whole grain products, and lean meats. These benefits would be communicated to participants in pre-program advertising to help them see the benefit in program participation. The messaging model for health communication campaigns will help direct program planning and evaluation. This model helps the program planners create a clear campaign goal, convene a work group, complete formative research, conduct process evaluation, and program adjustment. The proposed health communication campaign will target women living in low-income neighborhoods in Philadelphia, Pennsylvania, who either have been told by a healthcare provider that they have prediabetes or who screen at risk for diabetes on the CDC's prediabetes risk test. The campaign goal, therefore, will be to reduce the prevalence of diabetes and prediabetes in low-income minority women in Philadelphia. The work group for this campaign will include a variety of community members. Key community members like religious leaders, political leaders, and school leaders will be invited to help the program planners understand more about the target population and what their needs are. Meetings with these key community members will improve understanding of the population's needs and their health habits impacting their diagnosis of prediabetes. The target population will be surveyed to further understand their goals related to health and understanding of this condition. We will also include healthcare providers in order to figure out which women are most at risk. And we would reach out to community organizations, including YMCAs and food pantries, who may be more likely to interact with this population as well. Naturally, we would include communication experts to help us accurately reach the population in which we are targeting. After planning and implementation, process evaluation will assist planners in understanding who the campaign is reaching and how the messaging is being received. Planners will track engagement with social media posts, accounts, and web pages in order to measure success. We would also look at contacts to the program call center, enrollment in the program, and for those who do enroll in the program, how they continue to participate throughout the duration of the program. Based on data collected, the messaging and delivery of the program will be adjusted as needed to better serve the target population. Social media engagement with the population will happen under accounts titled Philly Prevents Diabetes. Platforms targeted will include Facebook, Instagram, and Twitter. Main targeting of our population will happen through a Reasons Why campaign. This campaign would include a series of posts showing local women sharing their reasons for participating in the National Diabetes Prevention Program and why they are making healthy lifestyle changes. Some examples of these posts would include a photo of a mother with her kids playing in a park local to South Philadelphia. She would speak to the program by saying, "I'm preventing diabetes so I can be here for my family." Another picture would be of a woman attending an Eagles game, saying, "I'm preventing diabetes so I can enjoy my favorite activities." Targeted mail and email to potential participants would invite recipients to complete an interactive version of the CDC's prediabetes risk test. Based on their answers, a score would be generated to indicate their level of diabetes risk. A score of 5 or higher qualifies someone to participate in the program. If this score is achieved, the participant would be routed to the program webpage where they'd be able to learn more about the program and how they could formally enroll. Here's a visual of the prediabetes risk test that would be adapted into an interactive quiz for those receiving the targeted mail and email. Finally, here is a mock-up of the Philly Prevents Diabetes webpage. We would discuss that this is a community to prevent type 2 diabetes, review the target population, talk about goals of the program, and review the benefits to participants. Individuals who visit the website would be able to learn more about the overall National Diabetes Prevention Program and would be able to take the risk test for prediabetes and type 2 diabetes. They would also be able to search by zip code, distance from their zip code, and language to determine where their nearest program would be located. They would also be able to formally register for the program from the homepage. The next 3 slides outline the references for the Philly Prevents Diabetes research paper and presentation.